All right. I'll introduce our first panelist. Professor Peter Donkor is Pro-Vice Chancellor of the Kwame Nkrumah University of Science and Technology in Kumasi, Ghana, and Professor of Oral and Maxillofacial Surgery. He's held many other positions, including Provost of the College of Health Sciences, Vice Dean, School of Medical Sciences, Head Department of Surgery, President of the Ghana Surgical Research Society, President of the Ghana Cleft Foundation, and inaugural President of the Pan-African Association for Cleft Palate. He's also served on numerous committees, including some here at the University of Michigan, the West African College of Surgeons Council, the American Cleft Palate Association, Ghana Medical and Dental Council, and I'm going to spare you, the list goes on for quite some time. He co-founded specialist cleft palate and head and neck oncology clinics at Kofi Anochi Teaching Hospital in Ghana. His research and publications covered medical education, health manpower, global health, open educational resources, head and neck cancer, cleft palate, trauma care, and emergency medicine. I also want to tell you that he is not only is he one of my favorite people in the world to work with, he's just one of my favorite people period in the world, as I've come to know him over the last 5 years, and has been a tremendous inspiration to me. I'm sorry I'm not going to be able to give the same introduction for all four of you, that last part.
Thank you, Tom. Mine is just to share with you my thoughts on how to design beneficial North-South partnerships. This is Ghana in bright yellow or gold. Ghana was previously called the Gold Coast. Where I'm located is in that part of Ghana, Kumasi. Now, this is the outline of my presentation. Just give examples of partnerships and how to avoid pitfalls. There are different levels of partnership, but for partnership to succeed, you almost invariably need a catalyst, or who I consider a champion, someone who will actually drive through the process and help iron out any difficulties as they arise. Now, this is an example of an unsuccessful partnership in our university. The Department of Community Health decided to partner with a Canadian university to train PhDs. It looks like that is as far as it went. They didn't really go into the details about the process. In the end, they selected students for training. 4 of them were trained, but none came back to KNUST. And the department decided that they wouldn't go into another partnership. Of course, the retention, that was the basis of the whole partnership, was, as an issue, was overlooked. I have a number of other unsuccessful ones. This is one, what I'll call an unequal partnership. The same community partnered the Ministry of Health and the British University on the vitamin A supplementation trial. Again, it was aimed at capacity building. But KNUST Community Health felt that they were poorly represented on the advisory board, and they were not consulted on many important decisions that were taken. And in the end, they walked out of the relationship. But that was to their disadvantage, because when the trial was over, the whole setup was left behind, which they never benefited from. But fortunately, it became an important research center, which was manned by the Ministry of Health. There have been very successful partnerships. The Malaria Gen project, which is a Gates-funded project, which is looking at malaria genomic epidemiology, and this involves several African countries. And at the outset of the project, they agreed on the standards on data collection, storage, sharing of information, ethics, intellectual property rights, authorship rights. And so everything that goes out is one that has been agreed. And as we speak, they've been doing pretty well. And recently they reported that they've been successful in identifying a vaccine which helps to reduce malaria by 50% in children. Another successful one was, which is initiated, or partly Michigan, was the OBGYN specialist training program in Ghana, which started in 1989. Several organizations were involved. Sorry, it's my mobile phone. Thank you. So technology catches up with Africa as well. And this was meant to train OBGYN specialists in Ghana and to transition the training to the Ministry of Health after 10 years. Through this program, almost all OBGYN specialists are trained in Ghana, and I can say that there's 99% retention of those who are trained. Previously, they were sent outside, trained for several years, 5 years or more, and only about 10% came back. Now it's been reversed. And this is a picture showing, unfortunately he's not here, Tim Johnson, a young Tim Johnson of OBGYN then. This is 1989. This is when they first signed. Now, Roger made reference to the MEPI project, which is currently still in its third year of implementation in Ghana. What I would like to say very simply is that through this collaboration, again, which also involves Michigan, emergency medicine, Komfo-Anokye Teaching Hospital at my university, we've been able to, for the first time ever, train locally in Ghana, 6 specialists in emergency medicine who passed the exam just last month. And the training is all done in Ghana and with the help of visiting faculty from Michigan. We hope that as we go into the future, these faculty will form the basis for future training. We've had other successful partnerships with Michigan, which again has been based on thorough discussion and engagement. And the African Scholars Program, I met a couple of people from Ghana who are currently on that. Now, collaborations sometimes go wrong. And there are several threats to them. If you need I think you have to look at a collaboration or a partnership as like a business. There should be clear line management. You should have a poor management structure, a good management structure where information flows. It's not like you're a boss and subordinate, but the flow of information should be very clear. Sometimes there's unequal interest. Someone says, well, I'm the boss, I brought the project, so you better go along with whatever I say. It doesn't work. There should be openness, and there should be also discussion on how the benefits are to be shared. Now, communication difficulties are real. There can be institutional bottlenecks, and team members also can be incompatible, and that can only come out later, but one must make an effort to find out compatibility issues. There's also local politics. Local politics takes many shapes, where right people, some people must be involved, otherwise you run into difficulties. But you also should not take on people who will also obstruct you. Authorships. Now, I put this inheritance without sweat. This is just something I coined, the phrase. And it is not, it's a bit like my father leaves me a lot of money and I spend it without knowing how he sweated for it. In the end, I'm going to run out of money. And it's like people spend a lot of time building up these relationships, like partnerships between institutions, and others may come and see these relationships exist. Now, they have to be brought on board and be made a part of it. Otherwise, they take it for granted and trample on toes and threaten the whole relationship. So this is bringing everybody on board. Now, many conflicts can be avoided. There was a project which Ghana had with the University of Michigan called the Charter, which I'm using as an example of how some of these can be avoided. And one of the objectives of the charter was devoted to discussing from the outset how conflicts could be avoided. And these are the partners. Among the objectives, which mainly involve training, research, data for policy making, and human resources, then research. It was important to ensure that there was this guiding principle for the charter to guide all of us, so we didn't do the wrong thing. It was made easy because Michigan and Ghana had a history, which is always useful, but it doesn't have to have a history. It must begin to talk honestly. This is a group of people who were at the first meeting. And at the end of it all, we agreed that we would do certain things, which hopefully we did. Now, and then we signed a charter for collaboration. You can see Tom in the picture. And this is the team. Now, as one thinks back on the charter project, we had some successes. There was improved dialogue among the stakeholders, and new collaborations also started, and students, staff exchanges came as a result of this. But it's important that, again, the benefits that were derived, especially from the individuals who first went into that, are extended to other people who will be part of future partnerships. I think at the beginning of every collaboration, and this bold thing is that you must ensure that everybody's interest in the partnership is known and addressed. You cannot assume it. The question is, what is the interest of the, let's say, third world partner in this collaboration? What's the interest of the northern partner in the interest? You must address that. You must look to sustaining it beyond the end of the project. So I think, as I said before, define the interests of all parties. There should be trust, mutual respect, communication, accountability, transparency. These are words that everyone is familiar with. But we have to ensure that it's sustainable and can be modified as we go along. Well, thank you. This is the entrance to my university. Thank you very much.
Before I introduce the next panelist, I just wanted to mention that Professor Donkor will be speaking tomorrow from noon to 2 p.m. in 1680 Community Crossroads Room here on perspectives on the health sector in Ghana. So you're all invited to join us. Okay. Our next speaker is Gary Harper. Professor Harper received his MPH from University of California at Berkeley in 1994, his PhD from Purdue University in 1993, also a master's from Purdue as well, and he went to Washington University in St. Louis as an undergraduate. His major areas of interest include HIV sexual risk among homeless adolescents, community-based HIV prevention for gay, bisexual youth, and Latina female adolescents, effects of negative affect and substance use on adolescent sexual risk, collaborative research with community-based organizations, community-based HIV prevention for adolescents in both the United States and in Kenya, lesbian, gay, bisexual, transgender adolescents, adolescent masculinity and sexual risk, psychological functioning of adolescents living with HIV, and community-university partnerships. He has published extensively on topics as a result of his innovative and collaborative partnerships. Professor Harper.
Good morning, everyone. Is everyone awake? All right, come on. I know you're students, a lot of you, and you've got the day off of classes, but you don't get to snooze. So I'm filling time while she's pulling up the slides. So Those of you who don't know, too, I'm also a new faculty member here, so I've only been here a month, so I'm very excited to be here. Spent 17 years at DePaul University in Chicago, and I'm really excited to bring my knowledge, my projects, and enthusiasm to Michigan. So what I want to do is in my short little time, is to talk to you a little bit about both work that I've done domestically and globally, because I think that as the previous speakers talked about, a lot of what we learn globally informs what we do locally, and what we do locally informs what we do globally. And I think when we talk about creating sustainable partnerships, a lot of the elements that we use in both types of partnerships, whether it be domestic or globally, we use the same kinds of things. So I'm going to be talking about some of my work in Chicago, where I worked for many years developing and maintaining partnerships with community-based organizations. And a lot of what I'll talk about is actually based on an article that I wrote in collaboration with community-based organization members and students on what are some of the elements that are needed in sustainable partnerships. But then also, I've been working in Kenya since about 2004, and there I have partnerships as diverse as working with the Catholic Church and the Education Commission within the Catholic Church, to all the way to working with small LGBT organizations in Western Kenya that are fighting for human rights and for health for young gay men. So a lot of diversity of different types of partnerships. So in the field of HIV, for those of you who don't know, a lot of the work that we do in HIV prevention really needs to be rooted in the realities of communities, because people receive services in the community. They don't receive services in a lab or in an academic institution. So we really need to make sure that the work that we do in these institutions are able to be transferred, and that's why when Dr. Glass was talking about implementation science, that's so important, that we really know how do we put these things into practice in the real world. A lot of times there's a break between the way that institutions of higher learning work and the way that community agencies and organizations that deliver the interventions work. There's different reward structures, different ways that people come to those spaces, and so it's important that we bridge some of those gaps. And we need to make sure that the partnerships that we create are really working on developing interventions that are relevant to the community, but then also feasible to be delivered. We can spend $2 million developing a randomized controlled trial of an HIV prevention intervention, but if you can't deliver it in a small community-based organization with a small budget, then we really aren't using our money in the best way. When we form these collaborative partnerships, researchers can share existing evidence-based knowledge and science. Agencies can use the data that's collected from these for policy and advocacy efforts and grant applications to inform and guide their future work. Also, they can serve as a catalyst for discussions, especially in working with youth, between youth and adult organizers in the community to see what should be the next steps. I'm going to go over three kind of primary areas of building partnerships, and this is based on an article that you see up on the screen, Diverse Phases of Collaboration Working Together to Improve Community-Based HIV Interventions for Adolescents. This article probably took me the longest to write of any article that I've ever written, because it was literally co-written by 3 members from a community-based organizations, 2 students, and myself. And it was truly co-authorship. It wasn't, I wrote it and gave it to them. We sat down for hours and hours, days for days, and mulled over every paragraph, every section. We had to do 2 sets of revisions. We were ready to shoot the editors at times, but it really did result in what I think is a good paper. I'm a little bit biased, I guess. So one of the things that we talk about is really the importance of building relationships. We really have to invest time in sharing information about work-related constraints, demands, and dynamics. If you're working with an organization, either globally or locally, that has some real physical limitations, you need to know that. Also defining each member's roles and responsibilities. I think sometimes we make assumptions about, oh, well, you're the academic, you're going to do this. You're the community member, you're going to do that. And those need to be very clearly defined from the outset of the project. Also, learning about the community agency culture by participating in activities and events. Part of why I love doing intervention development work and community-based work is I get to learn about people and I learn about cultures. So when I'm in Kenya, I don't just go to my meetings and sit in my office and then go back to a hotel room. I go out out and I have dinners. I go to dance clubs. I go to schools. I was in Kenya in August, and I was hanging out at a kind of hidden gay dance club on Friday night, and had the best time of the whole trip, because it was just hanging out with the guys and talking to them and dancing, and they were surprised that I could actually dance. It breaks down misconceptions. You look at an old white dude and think you can't dance, but people have skills that you don't always know about. So to me, that's what makes this fun, and that's what makes this work really exciting. Also, sharing your belief systems and value systems. We don't all have the same value systems, and when it comes to issues like HIV, we're talking about sex, we're talking about drugs, we're talking about condoms. These are all things that are loaded with socio-political, cultural, religious values, and so we have to be very careful that we have those open discussions. Are you an agency that believes in harm reduction or abstinence? Are you an agency that supports antiretrovirals at different levels for pregnant mothers? When should we give them? When should we not? So there's a lot of issues. And then also, there's certain rituals that occur within agencies. So there's certain ways that we do things. Like, for instance, there's an agency that I used to work with in Chicago called Project Vita, and it was in the Little Village community in Chicago, which is primarily Mexican and Mexican-American. Well, every day at about 10:30, Senora Maria would come by with food, and everything stops at the agency to go out and get your food. Well, we applied for a grant from the CDC, and the CDC came and did a site visit, and they're there, and it was this big thing. We were really excited, the first time the agency had ever applied for a CDC grant. Well, 10:30 comes, she rings her little bell, and everyone just bolts out of the agency. And the CDC folks are sitting there looking at me like, what's wrong? What's wrong? I'm like, well, let's go eat. And so we got out, and they kind of, I don't think wanted to really go at first, but we went out, we got some food, came back, and carried on the meeting. And that's part of the ritual, and we have to make sure that we conform and learn and adapt and grow with agencies and learn about kind of what their culture is, not just culture, ethnic, racial culture, but culture of the agency and of the organization. We need to build on existing strengths. I think, unfortunately, a lot of academics come in and think that they know everything, and we don't. We know something, and some of us are members of the groups. Some of us work in certain populations where we're part of that community too. I'm part of some of the communities that I work with as an academic, but as a human. And I think that we need to realize that when we're working with different agencies and organizations, they have a lot of strengths. So we need to create strategies for decreasing power differentials, because again, a lot of times there is that initial hierarchy. Doing things like just conducting meetings at the agency. In our work in Kenya, we trade off facilitation of meetings. The US partner leads it one day, a Kenyan partner the other day, and we go back and forth quite a bit with that. Work with staff to decrease or shift staff members' competing responsibilities. If you're working with small nonprofits or small NGOs globally or locally, sometimes they may be juggling 20 jobs, and so really making sure that they're able to put the time and energy into it. We do a lot of educational sessions to explain the purpose of the research and evaluation activities to make sure that people are really clear. And I have 2 minutes, so I'm going to go really fast. All right. Assess the necessary skills and resources required for the completion. So basically, whatever skills and resources aren't there, we do a lot of training to make sure that people are walking away from this partnership with new skills and new abilities. The last general area is building a sense of commitment to the project. And if you don't have a sense of commitment, then again, you might as well go home, because both members of the partnership, everyone involved, has to really feel like they have a part and they have a real say in it. And it shouldn't just be tokenism. That's another thing you have to be really careful about. And I get really frustrated seeing other projects where there's tokenism from people in the community, where it's like, oh, here's the token, gay man, here's the token African American, here's the token, fill in the blank. We need to really make sure that there's true voice in these partnerships. So we have to make sure that information is communicated with the team and the agency in whatever way is most efficient. When I'm in Kenya, it's SMS, it's text messaging. You don't call and leave a voicemail. There is no such thing as voicemail. So you have to learn that. That's the mode of communication. I've worked some with students when I was back at DePaul that were working with community agencies. And it was like, well, I sent them an email. And it's like, well, maybe they don't have an email. Maybe they don't have a BlackBerry. Maybe they don't like email and don't want to be tied to that. So we have to be careful about that. Also, creating short and long-term goals. I think as academics, we're used to delaying gratification. How long does it take to get your PhD, your MD, all these other things? Agencies may not have that luxury or may not have that mindset, so we have to create both short and long term. Get input from all members throughout the collaboration. again, doing training. I think I use a lot of visual timelines and accomplishments. And then a big thing that I do, and again, maybe this is just because I'm a fun guy, but I like to celebrate successes. So when we do something well, when we accomplish something, celebrate it. You can also gain a lot of weight this way too, because back in Chicago, we had a really good cupcake place down the street from my office, and so every celebration meant cupcakes. And sometimes my partner would tease me, it's like, oh, it's Thursday, are you going to celebrate that? But, have fun. And again, another great way to learn about the culture. These are just some quotes from the article. I'm going to read this one real quick from the executive director. This relationship began and continued to be one of mutual respect, participation at all levels of evaluation and planning, and a partnership where we all benefit. The evaluator's presence and extensive knowledge helped us learn a lot about process evaluation, and their patience with our questions ceased the feeling that we were intellectually inferior to them. They were constantly inspiring us to achieve higher goals, taught us to become better evaluators ourselves. We felt that there was no hierarchy and that we were all equal partners in an exciting project. Our experience was meaningful. They were truly a joy to work with, and we are sure that the relationship will continue to grow well after the evaluation is over. I still work with this agency now 15 years later, even though I'm in Michigan. Actually, I just got a text message from one of the guys yesterday, kind of checking in with me and seeing how I'm doing. Just some publications, too. I think it's also important that we put what we're doing in our partnerships out there in venues other than peer-reviewed publications. Those are great. Those are the currency in academic institutions. These are just some work from our partnership in Kenya. We're funded under PEPFAR through the American International Health Alliance, which is a twinning partnerships, and they fund north-south and south-south twinning partnerships. These are two recent publications that we've been working on to put those out there so people can learn from our partnerships. And then last thing, this is just from an article that one of my grad students has in press that was just accepted. We've been also studying partnerships from the side of the community partners and talking to them about what they want in partnerships. And some of the things just to kind of leave you with to think about is, how do you define partnership and project success? We may not define it in the same way. The partner may not see it in the same way as you. We need to build mutual trust and respect. We need to explore power dynamics. We need to share power if desired. Some of our community partners said, there's some things I don't want to have any control over. I want you to do that. Assessing strengths, and then creating equitable resource access and allocation to make sure that all the money doesn't just come to the academics, but it's equally shared between both sides of the partnership. Thank you very much.